Hello, my name is Dr. Grant Cooper. I'm the co-founder and the co-director of Princeton Spine and Joint Center. In this video, we're going to be talking about stem cells and back pain, and we'll distinguish between the hype, the hope, and the honest science. And you've probably seen headlines like "Scientists regrow discs with stem cells" or advertisements that sound like "Come in for a miracle cure today." So what's the truth? Let's separate that hype from the hope. First, what are we talking about? Stem cells are special cells that can grow into different kinds of tissue. The idea is if your spinal disc is worn down and painful, maybe stem cells could repair or even regrow the disc. That's the dream. But of course, dreams need testing. And science moves slowly because safety matters and these problems are complicated. Here's what's hot off the press. The big mixed bag, right? There was a brand new study in 2025 that looked at taking your own bone marrow stem cells and then injecting them into worn out discs. Well, guess what? Patients improved. But unfortunately, so did the patients who got the sham procedure. So the translation is that the improvement was likely from the placebo effect and not necessarily from the stem cells that were injected. The more promising study, there was another therapy, this one using lab-grown disc progenitor cells. Think of them as like baby disc cells trained to behave like real disc tissue. Well, in a large study, patients with single-level disc disease, that means just one bad disc, not 5 bad discs, had less pain, less disability, and even signs of discs regrowth on the MRI 2 years later. Now that's exciting. In fact, potentially it's very exciting. What about ongoing trials? Well, big companies are running new phase 3 trials. This is the last step before FDA approval here in the United States, and we'll likely have much clearer answers in the next couple of years. For now, the reality check is that there's no stem cell treatment that's FDA approved yet for back pain. The clinics that are offering it now, unfortunately, they're often not regulated, not proven, and sometimes they're not even using what they say they're using. The FDA has actually cracked down on some of these stem cell clinics. I personally know one well-known doctor at a relatively prestigious university hospital that had its clinic shuttered for offering stem cells that really weren't stem cells. So, look, it really is the Wild West out there for stem cells, even at reputable organizations and universities. So when you hear, promises that seem too good to be true, like miracles guaranteed, that should be a giant flashing neon red flag. So where does this leave us? Well, there's real hope, especially in carefully chosen patients with one bad disc. But for now, it's really clinical trials only. That's where the science is happening. That's where we know the treatment should be safe and monitored and honestly done. The bottom line right now is that stem cells for back pain, well, they're like a movie that's still filming, right? The trailer looks exciting. The early reviews are mixed, but definitely promising. But the full release just isn't here yet, and it's really not time to buy tickets from the guy that's selling the tickets out of his trunk. Thank you so much for watching. If you found some value from this video, please hit that like button, subscribe to the channel. If you have questions or comments, or if you'd like to share your own experiences with stem cells, especially stem cells for back pain, then please leave us a comment in the comment section. As always, I wish you all the very best of health. Thank you.